Welcome to the AI for Good Global Summit from Geneva. I'm delighted now to be joined by Li Lu, who's researcher and senior director for Alibaba DAMO Academy.
Yeah.
DAMO or DAMO, I'm not quite sure, but I think it's both. But for people who don't really know what that it is, it's a research lab, but tell me a bit more.
Yeah, Damo Academy is basically the Chinese name, like from Buddhism actually, for I guess from the Buddhism wisdom in a sense, and but it's basically Alibaba corporate research, and we have mostly two domains. The first is the computing structures. The second will be AI. So we are part of the AI division in that sense. Yeah, but we are the medical AI lab. Yeah.
Now, the AI for Good Global Summit's bringing together the UN's agencies, the private sector, policymakers, and the private sector like yourself. You all have to work together to make AI for good.
Yes, definitely. Especially, I think for health, health is basically a humanity issue, right? So it needs like we all together is highly regulated area, and you don't just win by having the best technology. You have to really pursue what you do for a good goal, especially to achieve a better health for all. I think that's very important. Can AI solve the health inequality problem? All these things it needs everyone work together. It's all our problem, right? So we all need to work together to solve the health problem.
When you talk about health inequality, what are you referring to?
I give you an example. Like in the morning I have a talk. I give you examples about so cancer screening is we have a solution as a human being. We have a solution, and at least two American companies in California, they offer like a very comprehensive evaluation for cancer screening, but only for very rich people. It's about $5,000 each time. Maybe people do it once a year or once a 2 year, and they basically serve the rich people from Silicon Valley and also the rich people from Middle East. That's primarily where the customer is. And we just really could not do it for everyone. One is the cost. Second is also the scalability. It takes hours each test, and we certainly do not have medical resource to spend hours for each people and spend $5,000 US dollar each time for each person. Yeah.
So for you, as we're trying to get towards the SDGs, health is clearly one of them, and you can play a role in that research lab.
Definitely, that's our goal. That's our goal. I know the UN initiative. I think that's very aligned. But health is an issue for thousands of years. We all need to solve that issue, right? And age, we are going to enter an aging society. No matter what, age is the single most important factor for all the major chronic disease and cancer. And in our current setting, the work we present today and in the near future, we'll be more focusing on have a universal way, a easy, convenient way, and to find the early cancer, and that's called cancer screening. So cancer screening is right now the first priority we're trying to solve for cheap, yeah, for high accuracy, high quality, but with great accessibility and low cost.
What do you say to those who say AI is ultimately going to be about replacing doctors,
Um,
the specialists?
uh, I think in surgical medical tasks, AI can do a better job than a human being. That's not to be surprised. I personally work with tons of doctors exclusively, right? If we were working on something to replace them, they will not be happy. And it's just being honest. It's more like we renegotiate with the doctors to redefine a clinical workflow, then the patient will be greatly benefit from the new clinical workflow, and the doctor are happy doing the work they like to do. So, for example, like right now, in the clinical workflow, doctor need to do very smart work. Doctor also need to do a lot of tedious work, and those tedious work actually are mission critical. Can we make AI to do it? Can we make AI to generate something amazingly well result, and doctor still need to verify it. And doctor needs to call the patient be back for follow up. and doctor need to give them suggestions what to do next. We need a human in there, but I think the AI can help doctor in order to help patients. I want to reiterate, patients are the most important.
So it's really enabling doctors or the specialists to focus on the most essential things and the things that they want to focus on, and leave AI the rest.
Yeah, AI can definitely do a lot of work, tons of more work. And in the current, I work in the hospital for 5 years, and in the current clinic workflow, there's a lot of things we should be doing. The doctor is not doing, AI is not doing. A patient needs that, so we need to make sure AI can do that, can fill the gap. Then it actually will make a doctor's job maybe a little bit easier to have better clinical outcome for the patients.
And as we mentioned earlier, as populations worldwide age, the need for medical care is more important than ever. So that AI can transform our society in the health side.
I strongly believe so, but it's not very easy to achieve, to be honest. Like a house is very important. We all want to have a healthy life, and a good quality, not just living longer, but really have a healthy happiness, high quality of life longer, right? And we do not have enough resource, clinical resource or whatever thing. We do not have enough resource to meet the demand for all the people. If we want to do health good for all, I mean all human beings, not just in the rich countries, and not for just rich people. And we need to really have a powerful, accessible, but cheap ways of providing some type of service for human. And I think that will be AI models.
Very interesting. Li Lu from Alibaba, thanks very much. And we have much more coming up here on the AI for Good channel, so do stay tuned with us.